Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
What is a urogynecologist?
A urogynecologist is a specialist that combines urology and gynecology. So we do pelvic floor work, specifically surgery, but also treat other conditions like recurrent urinary tract infections and overactive bladder. So trouble getting to the bathroom, urinary frequency and urgency, pelvic floor problems such as prolapse, which is when the organs are falling through the pelvic floor, which is essentially a hernia, or things like trying to hold your urine with coughing and sneezing and having trouble controlling that.
What is pelvic floor dysfunction and what causes it?
Pelvic floor dysfunction is disorders of the pelvic floor where there's a weakening of the pelvic floor. So we use it kind of as a blanket term to cover prolapse, which is when the organs, such as the bladder and the uterus or the top of the vagina or the rectum, can be falling into the vagina and cause symptoms of pressure and discomfort or sexual dysfunction or trouble holding your urine or difficulty with defecation or trouble holding the stool. One of the major risk factors is childbearing. As you can imagine, a baby's head, which is about this big, coming through a small orifice can wreak havoc on the pelvic floor and cause muscular dysfunction and connective tissue dysfunction. And over time, as women age, then the pelvic floor can become weaker and you can have these sorts of problems. But there's a very large genetic component. So women can sometimes have 10 babies and not have a problem at all, or women can have one baby or maybe none and have a very big problem with these.
What age groups are most commonly affected by PFDs?
It is true that pelvic floor dysfunction is more common as we get older. And 1 in 3 women might be affected in their lifetimes. So that's actually a really large percentage of women, as you might imagine. And so as the population ages, we're going to be seeing more and more of this. But women in their 30s and even 20s can end up coming in with these problems.
Are there any non-surgical options people can do to prevent PFDs?
There's a lot you can do. Probably a lot of women have heard of Kegel exercises. Well, that's the clenching that you can do in your pelvic floor. And not all women can do them properly, so it is important to potentially, if you don't think you may be doing them properly, maybe consult with someone. But doing Kegel exercises, especially after childbearing when the insult has happened, that's when the damage is done often, can go a long way to preventing these problems. But there's a lot of other things that can be done as well. So for example, for someone with overactive bladder with a lot of frequency and urgency that might happen, you can do things like avoiding caffeine or cutting down on artificial sweeteners or avoiding alcohol sometimes, because those are all bladder irritants, or doing timed voiding. So if you're going really, really frequently to the bathroom, but you don't have a lot of leakage, you can actually gradually train your bladder to hold more and more and cut down on that urinary frequency.
Is any amount of leakage considered normal, and at what point should someone consider seeing a doctor?
Well, I would argue that no amount of leakage is normal, but certainly if you have a major insult, like so for example, if you're vomiting or you have bronchitis and you're really coughing really hard, especially if your bladder's full, then certainly a little bit of leakage may be tolerable. And these are all quality of life issues. So if it's really not that disturbing to you, if maybe only once or twice a year when you've got a really bad cold you have to wear a pad, that's not such a big deal maybe to you. And so you don't necessarily have to go running into the doctor to go and look into that, especially depending on where in your life you are with that and what other issues you might have in your life. Or maybe you can't jump on a trampoline. But if every time you go running after your kids in the soccer game, you're having an issue and you don't feel like you can live the life that you want, then that's the time that you should maybe be seeking care or help. and talking to people that might be able to help you with this issue.
If someone is concerned, should they seek their primary care physician or should they seek out a specialist?
Talking with your primary care physician is a way to start, but a lot of primary care physicians are now aware that there are specialists that do this all day, every day, and they have the tools in our pockets to manage these things appropriately. But a lot of primary care physicians are aware that there are pelvic floor physical therapists that are a good first line person to help strengthen the pelvic floor. Or there are medications, for example, for overactive bladder that are effective and may be well versed in the use of them. And if the primary care is not comfortable, then they'll send to a specialist. So, really talking about it with anyone is a good idea.